Good afternoon, everybody. I would like to introduce myself. I'm Brad Cohen. I'm the mayor of the Township of East Brunswick. And for those of you that don't know, I am also, when I'm not mayor, a physician. So being here to kick off Health Literacy Month here in East Brunswick actually is a particular honor because it is something that not only I do, but East Brunswick has been sort of at the center for health literacy for years. This is not new. For most of you who don't know East Brunswick, we sit dead center in the center of New Jersey. We have Cranberry Road, which has been dubbed a medical mile because you will find hundreds of physicians, allied healthcare professionals, services, labs, all along that corridor. And we sit strategically between three hospital systems, Robert Wood, St. Peter's, and Hackensack Meridian. So our location is a blessing, and we have tons of people not only working here but living here who are in the healthcare professions. We utilize this library on a very regular basis, and you'll hear today from people who have participated in making the library's health, or just for the health of it program, something that has become recognized throughout the state. That recognition came even more so during COVID when the library sprinted into a mode of being able to work with the township officials and those of us in the healthcare fields to provide information to our residents on an ongoing basis. I think it is no surprise that East Brunswick within Middlesex County had one of the lowest COVID infection rates and one of the highest vaccination rates throughout the entire pandemic. I think it comes as a result of constant ability to provide our residents with the most up-to-date health literacy information and be able to make choices for themselves based on data and not on rumor and just hard science. Our science, our health professionals work constantly. That was recognized by an award this year that was given to our health literacy department, and a lot of the work that we've done all throughout the years is now being exported thanks to grants from the state and from the county throughout the state now. So I won't take up any more of your time. I'm thrilled to be here today, and I want to introduce to all of you Karen Parry, who is the manager of the Just for the Health of the program here in East Brunswick. So please give her a warm welcome.
Thank you all for coming. As Mayor Cohen said, I'm Karen Parry, manager of the library's Just for the Health of It Health Literacy Program. I'm happy to see so many library healthcare partners, colleagues, and members of the community who came out to celebrate Health Literacy Month with us. Health Literacy Month is a time to celebrate, a time to recognize that health literacy, the ability to find and use health information to make the best choices for our health, is what builds stronger communities. Today's celebration puts libraries and what we do best, literacy, right at the center. It's also a sobering time because it reminds us that health inequity is real, existential, and touches the lives of far too many people who are denied access to live their healthiest possible life. Low income, the elderly, new immigrants, people who are socially excluded. Many struggle to navigate the healthcare system, lack financial resources to own a computer to look up information or even look for a job. Many lack computer skills, have low literacy, don't speak English, have physical, visual, or mental disabilities, don't have health insurance to do preventive screenings, putting their lives at risk, or suffer quietly from racial or gender bias. This is but a small piece of a bigger picture of what health and justice looks like. And this is why health literacy and the collective power of libraries and community partners to reduce health disparities is so important. Today I send my heartfelt thanks to all of our community partners for seeing the value of health literacy and for supporting us on this long journey towards health equity. You made health literacy a part of your ethos by giving back to help thousands of people over the years who benefited from your time, your knowledge, resources, and compassion. From the most recent NJ Health Connect program supported by the New Jersey State Library that put 454 iPads preloaded with telehealth apps and health information into the hands of marginalized individuals in some of the most distressed communities throughout New Jersey, to the Health Information Library on Wheels, supported by New Jersey Health Initiatives and Healthier Middlesex, that visited nearly 10,000 people as it crisscrossed Middlesex County, bringing health information in different languages, and later when COVID hit, ran virtual programs when health information was at the peak of most needed by so many individuals. And all the doctors, students, and healthcare practitioners who ran countless programs with the library to educate and lift others. Thank you to all of you for your support, because every person who you helped along the way who became more informed and empowered has moved us all one step closer to health equity. And now I'd like to kick off this afternoon's program by introducing the Deputy State Librarian for Library Development of the New Jersey State Library, Michele Stricker.
Good afternoon, everyone. I'm Michele Stricker, and I am the Deputy State Librarian for Library Development from the New Jersey State Library. So, as Karen mentioned, NJSL or NJ Health Connect at your library addressed the barrier of access to care by providing 450 iPads to more than 150 libraries in the community. And it was a very successful program thanks to the East Brunswick Public Library. Now, the New Jersey State Library received funding from the American Rescue Plan Act, ARPA we call it, and that funding was distributed through the Institute of Museum and Library Services, IMLS. So that money, that funding was given to the state library for us to disseminate out into the field. And we had many, many meetings at the state library about how are we going to spend that funding. And one of the things that we determined, and a lot of the funding went to various kinds of literacy programs, but I really advocated to start a telehealth program, a pilot in the state, because I had already been involved on the National Telehealth Committee. And so when our state librarian, Jennifer Nelson, agreed to spend funding on this new telehealth initiative, I started doing my research about how could we best serve the people in the state. What kind of program would it be? Because serving on the National Task Force, every state that's involved in this, or every state library, has a different kind of program, anywhere from those kind of health pods that you see to little rooms where people can take their blood pressures and things like that. So I wanted to find out what would be best for New Jersey. I asked around, but then I had worked with Karen Parry in the past, and I knew that if there's anyone in the state that has expertise in this field, it was Karen at East Brunswick. So, I called her up and I said, Karen, we have this funding and I want to do some kind of a telehealth, telemedicine program. What do you suggest? And she said, well, I have a lot of ideas. And of course, she came up with a perfect program, I think, by offering these iPads for very low literacy people who don't have good access to broadband or access to go online. And we wanted to make it very, very simple. Yes, there's some involvement with the libraries and librarians, but we didn't want some onerous thing where librarians had to go in and clean out these pods after people use them. So it was really Karen who came up with this entire program of using the iPads, and she chose iPads rather than like Chromebooks because a lot of the health apps are only available like on iPads and not on the Chromebooks. So that's why we went with that. And she really planned out this entire program. East Brunswick really became a statewide hub to promote, health equity, and they disseminated all the iPads, and it was really due to their vision, dedication, expertise, and hard work that made this program a success. So at this time, I'm going to ask John, Arthur, and Karen, will you please come and step up here? I have a little something for you. This is just in recognition for your innovation and your leadership.
Oh, awesome.
One for you too, Karen. for your innovation and your leadership in this grant. Really, these two people, personally, I think delivered 450 iPads around the entire state of New Jersey. John didn't have an office for a year because it was, first it started off with 450 iPads in his office. They had a team having to load all the apps, wipe all the apps, and I just want to say that I don't think I've ever worked, and I've worked on a lot of grants, but I have never worked on one where, please come over here, where it has been, just better done than what you've done, and you've given it your all. And the State Library and I really appreciate the fabulous job that you've done. And John, could be done, the support of the director is everything. And John wholeheartedly supported Karen, and I think Karen was going to retire until she got this grant. And she said, I think I'll stick it out for another year. So, sorry or you're welcome. I don't know which one it is, but thank you both so much for running such a successful program, and I look forward to having it continue, and we have ideas on how to do that. So thank you.
Thank you.
At this time, I do want to say we have a representative from the governor's office here, so I would like to bring up Valerie Bullard, who works for Governor Murphy and serves as a state broadband advisor. So Valerie, the stage is yours.
Good afternoon, everyone. Thank you so much for inviting me, for one. My name is Valerie. As she mentioned, I work as a broadband advisor. And the great thing about that is the fact that I get put in spaces like this. I get the opportunities to work with the community and see the work that's happening right before our eyes. Health Literacy Month is a great opportunity to highlight not just what the public libraries do in the community, but the place that you cherish in these communities as well. Now, the pandemic definitely magnified these needs for the different vital resources, and things like access to different services, access to devices, all of that was compromised. And so when you have programs like NJ Health Connect, it really shows that our community is being heard. Their voice is being heard, and we're called to action. We're doing something about it. Now, knowledge is powerful. Knowledge helps you understand what your needs are, and it puts you in a position to advocate for yourself. But in order to build that knowledge, you need access to data. And so when you're in a position where you don't have that access to data, you become reliant on other programs or other things. And that can look like you going to telehealth and not being aware of what the doctor's trying to tell you because it may be in a different language. That shows in a space where your child may bring you into their sessions when it comes to evaluations from teachers. And again, you may not understand what tools they need. So it's not just health gaps that we're experiencing. Now that's moving to spaces where we're looking at our students, and we've got our education gap. Our workforce, and we have our workforce gap. And so when we speak about actual health literacy, the big picture of that is we're looking at our libraries as our digital navigators. People come to our libraries because they feel safe. They feel like they can trust our libraries and what they do in our communities. So when we turn around and we say that we have amazing programs with iPads that are available to students, to just individuals in general, you're telling your community, again, they're being heard, but they're coming to you not just for the devices, but for the services. So I've seen a number of times where there are programs to help people pay bills. There are programs to help people sign up for the Affordable Connectivity Program. And if you're not aware, that's actually one of Biden's hugest broadband initiatives right now. It puts our people in a place where not only are they heard, but that call to action gives them an opportunity to apply for a program that gives them up to $30 a month to put towards their internet service. That puts them in an opportunity where they have $100 that can go towards devices. Without access to technology, how would our citizens know about that? So, as we turn to our libraries and know that we trust them and acknowledge that they play a role far beyond health, we have to show how grateful we are to know that they are wearing a number of hats in our communities. And for that, thank you so much.
I'd like to please welcome Diane Hagerman, Deputy Director of New Jersey Health Initiatives.
Thanks, Karen, and good afternoon, everyone. I'm so excited to be here to join in celebrating Health Literacy Month as we recognize the vital role that libraries play in New Jersey and have embraced in advancing health equity. As Karen said, I'm Diane Hagerman. I'm the Director of New Jersey Health Initiatives, which is a statewide grant-making program of the Robert Wood Johnson Foundation. And NJHI's work includes driving conversations and building and strengthening networks of individuals and organizations committed to making communities healthier across New Jersey. One important partnership that we're talking about today is through the work of the East Brunswick Public Library and the Just for the Health of It program. Often what we refer to in our jargon as social determinants of health, things like access to reliable transportation, affordable and safe housing, quality education, and economic stability are overlooked as factors that influence health and well-being, yet they critically affect individuals' health every day. When you can't access or understand reliable information and trusted services, it's difficult to make well-informed health decisions. And libraries have a long history of meeting communities' need for information. Yet a growing number of communities across the state and nationwide are realizing that libraries are also key to improving health by breaking through accessibility barriers and meeting residents where they live, learn, work, worship, and play. A role that libraries so willingly embraced well before, but especially amid the pandemic. As part of our work to support the Robert Wood Johnson Foundation's grantees here in New Jersey, we've had the privilege to provide resources to mobilize the Just for the Health of It program that Karen mentioned through an initiative known as Health Information Library on Wheels, or HILO. This dynamic collaboration between the Healthier Middlesex Collaborative and the East Brunswick Public Library leverages the skills and training of public librarians to advance health equity among Greater Middlesex County. And librarians representing information services, adult services, and youth services are taking health information on the road to answer residents' questions at community fairs, film festivals, senior centers, schools, and other locations that are already a part of their daily life. On a broader level, they're building a network of trained colleagues with the capacity to sustain this initiative for years to come. HILO is an exemplar in improving health literacy with culturally competent information and programs that equip residents in taking an active role in advocating for and achieving optimal health. The HILO's virtual health programs are provided in different languages by healthcare providers and presenters who are community members, who understand the cultural norms of immigrant communities and factors that can be underlying barriers to health equity. Everyone plays a role in improving health literacy and promoting community well-being. Libraries are shelving their original outdated image and stepping up as community health partners alongside health professionals, businesses, educators, resident leaders, municipal agencies, public safety personnel, youth, and community-based service providers. So I want to thank all of you for celebrating with us today. I want to thank Karen for being a rock star in this work. And I hope that we'll all continue this journey to educate more New Jerseyans about the valuable role that libraries play in every community.
I'd like to please welcome Dr. James Salwitz.
Thank you, Karen. I've never been introduced by a rock star before, so I'm feeling pretty good right now. Those who know me, I'm Jim Salwitz. I'm a medical oncologist. I've been in practice in this community within half a mile of here for 35 years. During that time, we built that practice from just the two of us to actually, if you look at all the partners, 42 physicians and 12 nurse practitioners and staff of several hundred. It's been a really wonderful community in which to practice. We are winning the war against cancer. Yeah, cancer is still a terrible, horrible disease that causes immense suffering, and we have a long way to go. But we are winning that war. Cancer rates across the board are falling. Cancer cure rates are rising. Survivals are extending massively. the change is just radical. I was at the NIH in the 1980s. We had about 10 chemotherapy agents. We had no way to use them. We used them for everything. We were lucky if anything happened. And we used to say at the NIH, we used to say, someday we'll have molecular medicine, genetics. Someday we'll have immune medicine, use the immune system to fight the cancer. Someday that will change. Yeah, and that's happening, like, right now. The revolution is just astonishing. We have identified hundreds, now actually several thousand genes that are involved in the cancer process. And we can use those genes to understand the cancer, design therapy, track the therapy. It is mind-blowing change. We're using the immune system to suppress and attack diseases that we never could control before. Before I left my office to come here, I saw a woman who had melanoma, which had spread to her throughout her body, all over her body, 5 years ago. And she's been on immune therapy for 5 years. And I look at her and remember all those patients over the years that didn't have this treatment and think of the radical change. It is an insane revolution in therapy. There were 46,000 articles on medical oncology alone published last year. And patients are surviving longer and better. And what we can do is incredibly powerful and incredibly exciting. But this only happens, frankly, if people know about it. This only happens if people can understand it. This only happens if we communicate and we work together to build a common understanding of what is possible. And we may have incredible therapy right here in East Brunswick, right here in Middlesex County, but if people don't understand what that availability is, they don't understand what can be done, and they don't understand what is happening, that is a complete loss, and it is, and is an incredible opportunity that we would not grab. We have found with our engagement with this library, with health initiatives, with Karen, frankly, over the years, a partner in caring. This is not just something we do on the side because it's marketing or it's something we just, we think it's fun to come and talk about. We need to do this to connect to our patients. This process is a part of the constellation of care. Just as nurses and drugs and doctors and hospitals and surgeons are part of this, this key is a key part of the communication. We collaborate and we work together so people can understand, and people that may not have access to information can get information, and people can, once they connect to the medical community, can understand what is being said and what is possible. This is a critical part of what we build here. Mayor Cohen mentioned that we have the health corridor in East Brunswick, and we have hundreds of clinicians that practice in that corridor. One of the reasons they're here is this kind of a initiative, because it allows us to connect to the community, it allows us to empower the community, and allows us to communicate in that conversation back and forth of what is happening. So we are greatly honored to be part and to support this initiative, this library in any way. You're part of our care team. We couldn't take care of our patients without you. Obviously, we're committed to continue this process and support it in any way at any time. And for myself, my partners, my patients, thank you for everything you do. Congratulations.
I'd like to introduce Rob LaForgia of Healthier Middlesex.
Hi, good afternoon, everybody. I'm Robert LaForgia. I am the coordinator for Healthier Middlesex. And for those of you who don't know, or maybe have slightly heard about Healthier Middlesex, we're a consortium of organizations, 60-plus organizations, led by Robert Wood Johnson University Hospital and St. Peter's University Hospital in New Brunswick. I began working with Karen and her team when I first came into my position all the way in 2018. It's hard to believe it's been that long. And I got involved within their high-low program, really spearheaded by Karen and Jag Vasudev over there. And for those of you who don't know, high-low was a community and continues to be a community outreach program that deploys Karen's team of librarians throughout different venues weekly, where they'll be able to provide the community really understandable, multilingual health information in really a fun and festive way. And so really the goal of the high-low program and the Just for the Health of It program was and continues to be to enlighten and empower at-risk populations living with chronic conditions to adhere to better self-management, encourage preventative care behaviors for children through seniors, improve patient-doctor communication, promote access to health insurance, and really provide better knowledge of how to find reliable health information and community resources. And Karen and her team have been really knocking that out of the park. And from 2018 until the pandemic year, in March of 2020, Karen and her team were able to see over 5,000 people at different community events such as school health fairs, the Middlesex County Fair, book sales, setting up tables at the mall, different gyms, senior centers, libraries in the park. And so really going out to a vast array of different community events to really bring this health information to the public. Post-COVID, with everything that happened, seamlessly Karen and her team migrated to a virtual platform. And over the time of our grant with the New Jersey Health Initiatives, in that just short period, we reached over 4,000 people attending virtual programs in all different languages, in all different areas of health and wellness. And during that same time period, librarians answered over 900 questions about health topics from the public, and were able to provide them reports on these various health topics in their own native language and their own literacy level. And so really bridging that gap between health information and the community. Another unexpected outcome was the overwhelming need for social work services prior to COVID-19 and really through the pandemic. And the library was able to partner with the Rutgers Graduate School of Social Work and Holy Family Parish in New Brunswick to offer a library intern and a bilingual social worker working up to 20 hours virtually a week to really provide and bridge that gap. Through this program, we've really witnessed how hospitals and public health library partnerships have the power to influence community health in a non-threatening way and really be that face of health information. And one story that comes to mind in particular was from a event at, I want to say it was maybe the Sayreville Senior Center, where one lady came up to the table and shared that she tries really hard to take care of her health. She attends exercise programs at the senior center. She reads all the literature that organizations bring. She goes to the fitness club. And she says, quote, I am the one in charge of my health. No one can take care of me but me. And then she went and subsequently picked up every flyer from the table and then went through all of them and picked up additional ones for her friends. So with that, really giving the power back to the individual and giving them the enlightenment to know that they can actually do this work themselves. So on behalf of Healthier Middlesex, we are honored and proud to continue and partner with Karen and her whole team on continuously striving to ensure our community is both enlightened and empowered to take control of their health and feel comfortable. So thank you.
I'd like to welcome Dr. Kenneth Freedman, President of the East Brunswick Advisory Health Council.
Thank you, Karen. It's great to be here with all of you today. Again, my name is Dr. Ken Freedman, and I am the chairman of the East Brunswick Advisory Health Council. I've served on the council for the last 30 years, and our role is, when called upon, we provide the mayor and town council with information that they need to be able to make more informed decisions that would benefit the public welfare. I have special interest in this library, and the main reason why is because I live here. I live in East Brunswick. My wife and I have raised our family here, and our children have used this library. And really, I want to acknowledge Karen in particular. She's very modest, but I think she's one of the main reasons why health literacy in East Brunswick and the surrounding communities is as good as it is. And I also want to acknowledge John Arthur, the library director, for sharing in our vision and supporting this so fervently. I really appreciate everything that the library is doing to help us. And Mayor Cohen, you know, in the township, again, without your help and support, it would be a totally different place. It's a much healthier place in which to live and work. Well, what do people really want? You know, if you ask people what they really, really want, if you said to them, well, listen, you know what? We have a system of care where you can wait to get sick, and then we can treat, drug, cut out, give therapy to the affected parts. Well, that's a necessary thing. You have to have that. But what's happening today is that people are looking for much more. As Rob had alluded to in his presentation before me, people are taking more responsibility for themselves and their health. That means it's up to them. And if there's one thing that we know, it's that we need to be able to better respond to the physical, chemical, and emotional stresses that we're subjected to on a daily basis. It's a tough world out there. The one thing that the pandemic has taught us is that the healthiest people are the ones that are in the best shape to be able to have the strongest immunity and be able to respond to any medical protocol that's going to be used, so they have the best chance of survivability and being able to thrive. So one thing that I'm very proud of is a new section that's been added to this library that I believe is the first of its kind in the state. It's called the Natural Health and Vitality Collection. It was funded privately and includes a wealth of information of what people need to know in order to be healthier on their own, to be able to identify and remove the interferences to the body's capacity to be able to heal and function better. You know, healthcare changes so much over the years, especially in treatments and drugs and therapies and surgeries. There are advancements being made, excellent advancements every day. But the one thing that we know of that's true, the one thing that endures, is that the body is self-healing and self-regulating. That it's the energy that flows over the nervous system that controls and coordinates all function and orients you to your environment. If you mess with it, that's a bad thing. And finally, if you identify and remove interferences to the flow of that energy, then the body is always better off than it would have been if that interference was left uncorrected. So the Natural Health and Vitality Collection includes excellent information on how to eat right, how to exercise, and think good thoughts, and get your rest, all things that our parents taught us to do when we were kids, when that was the foundation of our understanding of where health comes from. But it also includes information about vitalism, about not so much about separating the body into separate sections and then just treating those sections that have gone awry, but also about how it's part of an integrated whole, and it's important to make sure that the body has integrity so that it functions at its best. That not only gives people more information that they can use to be able to decide the best type of care that's for them, not only to stay well, but also where to go if they become ill, but also gives physicians a resource where they can come to the library and they can understand more so that they can have an expanded clinical vista, because healthier patients have better clinical outcomes. In addition to the materials that are in the Natural Health and Vitality Collection, we also have some cutting-edge technology that's available called the Neuropathylator. It's an interactive program that people can access using their library card on the computer that explains and helps them understand more about the vital connection between the energy flowing over the brain, the nervous system, and the body, how all parts work, what happens when there's interference, and what they can do to remove that interference and stay healthier. In working together collaboratively, we can help make our community a healthier place. And I'm very happy to see this new collection complement the vast collection of medical resources that already exists in this library, so that our community can not only continue to be a healthier place in which to live, but people can have the lifestyle of their dreams. Thank you.
Okay, and last but certainly not least, I'd like to welcome Susan Giordano, Susan is the Program Director of the Homeless and Indigent Population Health Outreach Project. I'm going to let her explain that acronym to you at Robert Wood Johnson Medical School, and a special guest, Kellyanne Costello, medical student.
So good afternoon. My name is Susan Giordano, and I am the Hip Hop's Program Coordinator. I do not rap. People oftentimes think that I can throw out bars, and I can, but we'll do that later on. But it stands for the Homeless and Indigent Population Health Outreach Project. It's a student-run community health initiative located at Rutgers Robert Wood Johnson Medical School. It was founded in 1992 by two medical students that were extremely interested in community service, community outreach, and how they could apply it through their science curriculum, which our school does really well, and go out in the community and see what the needs were for the community. So it was founded in 1992. It's 30 years. I've been there 23 years of the 30 years. And I'm happy to say that we have a ton of medical students that have had the most amazing time working with Karen for over 15 years already in many capacities. And she has been a great teacher. And to be very honest, I'm a little selfish in the fact that I introduced the students to a librarian. I love libraries. I was raised in the South Bronx, and my safe haven was a library. So when I heard that there was this librarian that was interested in health literacy and was willing to partner with us, I was like, this has to be someone I need to meet. I need the students to meet, and I need the students to learn from, because we can provide all the information that we have available to us, but as everyone mentioned throughout this whole session, access is essential. And if we are not aware and we don't have that access, we don't have the ability to share that information. Karen has done a wonderful job working with medical students. She has come to our school and spoken about all the programs here at the library. She has partnered with us. We've had first years coming in fresh-eyed, ready to work at the medical school, and have come here to do community service and learn what the library is about and what they could do as future physicians in sharing the information that the library has and the resources the library has. So I'm very happy that you invited me here, but I'm even more happy that I met you and that I could continue my passion with the library and share that with others. And with that said, I would love Kellianne to talk about how she's been partnering with the library.
Hi, my name is Kellyanne Costello. I'm a fourth-year medical student at Robert Wood Johnson Medical School, and I'm part of the DISC program at Robert Wood Johnson, and what that is, it is a distinction in service to the community. So it's a distinction program, which means it'll go on my transcript, and it works that the school and the hip hop program takes medical students, future physicians, and partners them with community programs so that they can have long-term relationships with the community in these programs that we create. So I work with 3 other medical students, and we created a program in 2020, I think in the fall of 2020. It's called Wellness Around the World, and it is a video series that you can find on the East Brunswick YouTube channel that aims to teach children, really anybody. It's kind of cartoonish, so it aims towards kids, but it's useful for anybody. And it aims to teach kids about wellness around the world, so it teaches them about different foods and different recipes, as well as like different healthy lifestyles that people practice in different countries all throughout the world. So each video of the series is about 10 minutes long, and it focuses on a different country and what they do in that country and what they eat to stay healthy and what they do to stay healthy, and it's like a little kid cartoon character for each one. And so our goal for that is, as a medical student, a future physician, I'm very fortunate and privileged to have the access to the education that I do, and me and my fellow med students that are on this project with me felt like it's our responsibility to help share that education, especially with kids in the community. Maybe they'll be future physicians one day, who knows, 20 years down the line. But we feel lucky to have the opportunity that we have, so we wanted to share that with more people. And like Susan said, they've been working with this library longer than we've been in med school. So when we came up with this project, we reached out to Susan, we proposed it, and she said, oh, great, like we've had many other students work with the East Brunswick Public Library. And so we reached out to Karen and some of the other people here, and they were so happy to take us on board. They've made it so easy to have our project, to connect it to the community. As medical students, we spend a lot of our time in the hospital and in the offices working, so we get to connect with our patients there, but we don't always get to connect with the community outside of those. So it was very nice to have this connection to help us spread our project. They make it so easy, they're so supportive, and we're really thankful to have them and to be able to spread our mission through East Brunswick and anybody else in the area that wants to connect to their YouTube channel. So we're very thankful and appreciative that we have this opportunity.
I'd like to thank all of our presenters for such wonderful overviews of how you support libraries. And thank you for taking the time to recognize that libraries are important players upstream in building healthier communities. So thank you everyone for coming. I hope you'll stay and mingle, enjoy some cookies and refreshments, and get to know each other. And thank you again for recognizing the importance of health literacy and libraries.